Hello everyone, in this video we will talk about the anatomy of the common carotid artery. So the common carotid artery arises in the thorax itself, okay? On the right side, the arch of aorta will give the brachiocephalic trunk, and from this brachiocephalic trunk we will get the right common carotid artery. Whereas on the left side, the left common carotid artery comes directly from the arch of aorta. Okay, so this is something you have to remember about the origin. The right common carotid will come from the brachiocephalic trunk, but the left common carotid will come directly from the arch of aorta itself. Now after this, after they begin in the thorax, they ascend anterior to the trachea. So you can see here, these are the carotid arteries on both the sides, and they will ascend anterior to the trachea, and they will be located just a little bit to the left. So if you can see here, they are both coming from the left side. They are both directed a little bit towards the left, okay, and they will ascend posterior to the sternoclavicular joint. So we have the sternum over here, we have the clavicle over here. They will ascend posterior to the sternoclavicular joint to enter the neck. Okay, they will be located a little bit towards the left, and they will both ascend to the neck from behind the sternoclavicular joint. Now in the neck, both of the common carotid arteries will be located in the carotid sheath. So they are present in the inside the carotid sheath, and they will both have a similar course, and finally they will bifurcate at the upper border of the thyroid cartilage. So you can see here, this is the thyroid cartilage, and then at the upper border of the thyroid cartilage they will bifurcate into the internal carotid and external carotid arteries. You can see here on this lateral view also, this is the thyroid cartilage, this is the upper border of the thyroid cartilage, and at the upper border they are both dividing into the internal and the external carotid arteries. Okay, so this is another point to be remembered. The bifurcation of the common carotid artery happens at the level of upper border of thyroid cartilage. Now let us look at the relations of the common carotid vessels. So anteriorly we have the superior belly of the omohyoid muscle. This is the superior belly of the omohyoid muscle over here. Okay, this will be located anteriorly, and also we have another muscle, which is this one, the sternocleidomastoid. You can see here, this coming from the mastoid, inserting into the sternum and into the clavicle. This is the sternocleidomastoid, which is again an anterior relation of the carotid artery. One vein which is an anterior relation, and that is this anterior jugular vein over here. This will also be located anteriorly to the common carotid. Two more muscles in the neck that are located anterior to the common carotid artery. This is the sternohyoid, and then we have the sternothyroid. So all of these muscles and the anterior jugular vein will be located anterior to the common carotid artery. These are the anterior relations. Now if we look posteriorly, if you look at the posterior relations, you can see this spine, okay, the lower cervical vertebra you can see. Okay, so the transverse processes of these lower cervical vertebra, particularly C4 to C7, okay, these are the posterior relations. This is the artery over here, these are the vertebrae over here, so these are located posteriorly. Okay, these are the posterior relations. Along with that, they have a few muscles attached to these vertebra, the longus colli, longus capitis, and the scalenus anterior. Okay, so these are the posterior relations, the transverse processes of the vertebra and muscles attached to them. Apart from that, we also have the inferior thyroid artery, which is also a posterior relation. You can also see this artery over here, traveling through the foramen transversarium of the vertebrae. This is the vertebral artery. So this is another posterior relation for the common carotid artery, the vertebral artery. And apart from that, we also have the thoracic duct on the left side. Okay, so what you have to remember here for the posterior relations: the transverse processes of the vertebrae, lower vertebrae, the inferior thyroid artery, the vertebral artery, and the thoracic duct. Medially, we have the thyroid gland. So if you can look here, this is the artery, the common carotid. Medial to it, we have the thyroid gland, and we will have the larynx and the pharynx. Okay, so this is the entire larynx we have here. The larynx, the pharynx, the trachea, esophagus will also be present medially. If it will be present posterior to the trachea, but they are all medial relations. This thyroid gland, the trachea, larynx, pharynx. You can see here in this view as well, we have this trachea which is present medial to the carotid arteries. One nerve present medial to it is the recurrent laryngeal nerve. You can see this over here, the recurrent laryngeal nerve. This is also a medial relation. Lateral to these arteries, we have the internal jugular veins. So both of these internal jugular veins are present lateral to the common carotid arteries. And then we have a posterolateral relation, structure that is located posteriorly and laterally. This is the vagus nerve. The vagus nerve on both the sides will be present posterolaterally to the artery.